nurses are right.
You'll be able to get
You got-
emergency care. They won't turn you away from the emergency room. But if you need long-term follow-up care, you won't be able to get it. You won't be able to get any further.
First of all, the fine goes up, and I've forgotten exactly what it is, but it's really quite extraordinary at the end. No, it goes up into thousands of dollars by the end of the decade. It goes up.
Oh, by the end of the decade.
And second of all, what you're going to have is
in year one it does.
what you're going to have instead of insurance is personal bankruptcy. That's the trade-off. That's what
IRS, you mean?
No, personal bankruptcy, where you go into the emergency room and it's $4,000 for whatever treatment it was. I mean, this is an actual case that we had in the office. The poor man died at Seton after 3 minutes, and it was a $4,000 bill. So you go into the emergency room thinking you're going to get, quote, free medical care. You'll get a $4,000 bill. And like this woman who negotiated it out, it takes about 4 years of personal bankruptcy. She didn't have to do personal.
That's all in the bill right now.
No, that's the law at the moment. The way the world works at the moment is that if you don't pay your bills, you either get hounded for years. In fact, in some cases, the hospitals will excuse your debt and turn it over to a bill collector so that they can then go ahead and hound you for another decade. Those are real cases. So it's not at all the case that if you pay $325, you're somehow
Well,
off.
even if it's $4,000, it's still a lot less than a lot of people are paying right now.
Well, no, but no one's going to be paying extraordinary health
That's
insurance anymore. That's what we're going to bring the cost of health insurance down. You're not going to be paying more than 13% of your income for health insurance.
Well, they did a CBO.
What,
The CBO numbers.
CBO numbers?
Okay. You can only analyze the numbers that are given in front of you. And it just came out a week before the healthcare vote. There's an independent study that Kathy Savilas got, and it said it was going to cost $3 trillion. And she held that back. She held it back and did not want Congress to know about it because it would have been very unpopular for the country, and then you would have done even more grief.
Well, I mean, I don't know anything about this study. I would think that I would know about it if it existed. The Congressional Budget Office.
I'll send it to you.
Okay, you send it to me. The Congressional Budget Office said that in the first 10 years, we saved $200 billion, and in the second 10 years, over $1 trillion. Yes.
Thank you for coming, Congresswoman. I just wonder why every time Congress passes a bill, they give so much leeway to all these companies, insurance companies, and it applies to all the companies, credit card companies, the car companies, give them 18 months, 5 years to do whatever. When they want to raise rates or whatever they want to do to help themselves, they can do that immediately. So why do you give so many months or years to them to come to do what we need done now?
Well, someone said lobbyists. It is
Forget
all about the power of influence in Washington.
You got to stop that.
Well, yeah, you know how we stop it? We do public financing of campaigns, and you won't have this issue. Of that happening is remote, but everyone should appreciate your insurance premium has folded in there the costs that they pay to lobby against your interests. So in the end, we would just be, far better off. Yes.
Okay. I understand Senator Feinstein is working on a companion bill to regulate insurance rates, health insurance rates. To be wrapped into the banking reform legislation. Do you know anything about that?
It would be a rate regulation model, much like we have. There's about 22 states that have it. California actually doesn't. We don't have rate regulation for health insurance. We have rate regulation for automobile insurance. But what was very interesting here in California, a 39% increase that Anthem Blue Cross was announcing it was going to impose. The Department of Insurance then looked at its numbers. Now, they looked at their numbers and found out that their math was wrong. They double counted people. I mean, you probably heard this. So now, with their tail between their legs, Anthem Blue Cross has withdrawn their request for. But I mean, imagine. I mean, it wasn't even an actuarial discussion. It was a bad math. That's right. So that's why rate regulation is important. That's why I think we need to move in that direction. But at the very least, there has to be some kind of oversight to be able to look at the numbers.
Over here.
Yes. Yes.
Excuse me, my arm so long. Anyways, how are you?
I'm fine, girl. I like your t-shirt.
A friend of mine, I always say a friend of mine gave this to me. Anyways, what about, now, I'm taken care of by the government. Of course, I also have insurance by my union. It's kept me ever since I was 65, which is, oh God, I give them a run. But my insurance went on there. But nevertheless, I'm covered. Now, do I still pay that $300 and some odd dollars?
No. Well, he's in Medicare. There are wraparound programs in Medicare that provide additional benefits. And you really want to look at to see if you would want to keep it or not. You may want to keep it because you may not pay any out of pocket. You know, the 80-20% that exists in Medicare now will continue to exist, but you might have an insurance policy that covers that 100%.
Yeah, well, as I was saying, that my government, I'm disabled from the, and not the Spanish American.
I think what you should do is call the office and you should look over and help you decide. Okay. Yes, back there.
Do you think the fact that we're such a litigious society is one of the reasons why our healthcare costs are so much greater than other countries?
No. That argument is used over and over again, but the great example is right here in California. We have tort reform in California. We have a law that's been on the books since 1975 called MICRA that basically caps the pain and suffering to $250,000 in any kind of a medical dispute. Well, that's not even subject to an indexing. If it was $250,000 in 1975, it would be $1 million today. In today's dollars, it's still at $250,000. So we have it. The cost of healthcare is still expensive in California. It's about other things. It's about, you know, the churning that goes on, the shifting that takes place, the uncompensated care. It's all those things that have played into it. And let's be real clear, the profits for the health insurance companies. I mean, think about it. We allowed, in California, we allowed not-for-profit health insurers to go for-profit.